How do bipolar antipsychotics block dopamine receptors? Have you ever wondered how medications for bipolar disorder actually work in the brain? One key player in this process is dopamine, a neurotransmitter that influences mood and behavior. Bipolar antipsychotics primarily target dopamine D2 receptors. These medications act as antagonists, meaning they bind to these receptors without activating them. By doing this, they prevent dopamine from exerting its effects, which is crucial in managing symptoms like mania and psychosis. In bipolar disorder, especially during manic episodes, there is often increased activity of dopamine. Antipsychotics help reduce this overactivity by occupying D2 receptors. This action decreases dopamine signaling in areas of the brain, such as the limbic system, which is involved in mood regulation. As a result, these medications can help stabilize mood and control manic symptoms. There are two main categories of antipsychotics used in treating bipolar disorder. The first is typical or first-generation antipsychotics. These medications strongly block D2 receptors but can lead to side effects like muscle stiffness and tremors. This happens because they also affect dopamine pathways involved in motor control. The second category is atypical or second-generation antipsychotics. These also block D2 receptors but have additional actions. They antagonize serotonin 5-HT2A receptors, which helps lower the risk of those motor side effects. Some atypical antipsychotics have a lower affinity for D2 receptors or act as partial agonists. This means they can partially stimulate the receptor while still blocking excessive dopamine activity, creating a more balanced effect. A newer class of bipolar antipsychotics includes partial dopamine agonists. Medications like aripiprazole, brexpiprazole, and cariprazine fit into this category. They modulate dopamine activity by acting as antagonists when dopamine levels are high and as agonists when dopamine levels are low. This approach helps stabilize dopamine signaling, reducing side effects while improving symptom control. In summary, bipolar antipsychotics block dopamine receptors mainly by antagonizing D2 receptors. This mechanism is essential for managing manic and psychotic symptoms in bipolar disorder. However, it is important to remember that careful dosing and monitoring are necessary to balance the benefits of these medications with potential side effects. If you have questions about your treatment, always consult with a healthcare professional for personalized advice.